Okay, welcome everyone to this episode of Freedom Hub's Working Group. I am your host, Jeff Cantor, along with Charles Frohman. We're sponsored by the Freedom Hub, which is located at your-mp.com for standing for the marketplace for health, wealth, and freedom. We are the disruptors intersection, as you will certainly understand once again today. We do run a parallel show in the evenings on Freedom for Healthcare, so you'll certainly want to scope that one out. But then again, most importantly, we kind of hub off of this site. So let's take a quick gander at it. When you pop over here, you'll see there's an awful lot to look at. Scroll down, there's a variety of things to look at in each of these pages. Under the first tab, we have the webinars, which is pertinent to today. The continuing the conversations is kind of what happens next. So let's kind of look at that for a quick second. After the call today, you'll be able to connect with the guest. So in all these past episodes, here's your way to connect with these people. And then on top of that, we also have programs and people fighting for our freedom. So under this particular tab, you will see there's some action items, different organizations that are fighting for freedom you want to be aware of. So you'll certainly want to participate there. But as far as for today goes, if we come to the webinar tabs, if we hover over home and click on webinars, you'll end up on this tab. Gives you a little rundown of what we're doing in general, breakout on the two calls and who's on them. A little further down, you'll see the little upcoming area. And then here's the real big important part is this is where all the videos are archived. So this video will be on BitChute, Brighteon on YouTube, and Rumble. You'll come back to your-mp.com and you click on whichever platform you prefer. Here's an example is Brighteon, and you'll see all of these videos going back every Wednesday for years, actually. And there's some really fantastic stuff. You'll certainly want to scope out some of these old ones and then connect through that conversation, as it were. And this video will be up first of the week at the latest. So just be aware that's the routine on the release schedule. But let's find out what is in store for us today. So I'm going to turn the reins over to Charles here at the moment.
Thanks, Jeff, and welcome, Jeane. As I wrote up in the email for those that read it, the hook for today is the statistic that some folks know, but a lot don't, that the biggest source of death for humans, at least in the West, after cancer and heart disease, are accidents at the hospital from your doctor. Misdiagnoses, botched surgeries, overdoses, wrong medicine, a host of accidents. But what I discovered accidentally in finding Jeane's Twitter handle was that there is a silent source of harm with these same doctors that once I read a bit about it makes sense. And it stems from a few stimuli that I'm sure Jeane will correct me on, or at least expand, and one of which is the doctor complex, where doctors think they can get away with anything because they know everything, and patients are just groundlings there to do what you say and not ask questions. Or it could stem from the fee-for-service system of market medicine, where you get more money for procedures. And I know she's going to talk about informed consent, which has been on the minds of a lot of people, half the country probably, regarding these vaccine passports that are going to threaten all of us for us to keep our jobs or be able to get into a store to shop or travel or learn. But her informed consent is a bit broader, and it has to do with any kind of procedure you end up having to have in the hospital or anywhere else with a specialist. And it really regards an unequal relationship between the patient and the doctor. And I know, Jeff, we've had guests over the years like Charles Benz, who, because so many folks are learning about natural care, have had to lie to their doctor about what they're doing after self-diagnosis. They don't trust their doctor enough to tell them what they're doing. And, maybe there is a serious, bigger dynamic here where the doctor-patient relationship is imbalanced for a lot of reasons. And maybe it's pathological, and maybe it's reached dangerous proportions, and we have to pay attention to this. So Jeane has some colleagues that focus on different aspects of this abusive dynamic. So let's sit back, Jeff, and listen to Jeane educate us about a topic that more people should know about.
All right, very good. Well, on that note, Jeane, I'm going to disconnect my screen and give you control.
Okay, my name is Jeannie Roller, and I'm going to be talking about patient rights, the basics. What are the basic patient rights? Every patient has the right to autonomy, and every patient has the right to dignity. Why talk about it? Well, we covered this before. Around 250,000 to 400,000 US patients are harmed each year. Now that is just the ones that are reported. It makes it the third leading cause of death in the US. This does not also take into account the ones who are just termed as being just harmed. Medical harm can either be a mistake, an error, or it can be intentional. Medical and sexual trauma can lead to medical PTSD. Medical sexual abuse of a patient is an intentional harm. Education is the key in reducing intentional harm and medical harm. The medical system needs to know that the status quo is no longer acceptable, and patients need to know their rights and know how to defend them. Intentional harm should be recognized as a criminal behavior. Something that is rarely not talked about much is intentional harm, and more to the point, criminal behavior in the medical community. The medical community is shrouded in secrecy. When challenged, they will circle the wagons and defend one another. Crimes committed by medical providers usually share one common thread. That is, they know about it. Other medical providers know about it, such as in the Earl Bradley case. The medical board knew about his behavior for years, but shrugged it off as being he was just up to his old tricks. And that old trick was molesting babies and toddlers. Gender-based medical harm. Far too many medical providers simply do not care about the way they are delivering their services and that they are actually harming the patient. Now, that's not to say that there aren't many good medical providers, because there is. But because some people are being harmed, they avoid medical services. Males are more likely than females to avoid service, and roughly around 91% of nursing staff are female. And overall, 76% of all healthcare workers are female. Society seems to be in denial that sexual abuse of male patients by female staff is occurring. This is a taboo subject. You cannot get it investigated. People laugh. Hateful thoughts, harmful actions. The other danger that has come to today's forefront is that there is too much hate for others in society, and society itself seems to be justifying the use of hateful actions against certain groups. You can have medical harm inflicted upon you simply for your political affiliation or your gender and other things. It is a myth that we have been told for years that the medical providers leave their personal biases and/or sexual feelings at the door. They don't. If this was the case, we wouldn't be reading stories about men like Larry Nassar. We would know that people in other professions are using their personal biases, hate to harm others. Why can't we believe a medical provider can do the same? Autonomy, informed consent. Autonomy is the right of any patient to be able to make a truly informed decision about anything that affects their body. You have the right to be given all the vital information in order to make an informed decision, and all medical treatment plans. The information must be provided in an atmosphere free of coercion or bias. It must be provided in a way that you understand. It is your decision to have an advocate of your choice present during any of these discussions. Depending on your state laws, you also have the right to record conversations. Again, You must check your state laws because some states like California do not allow recordings of private conversations, but my state, Indiana, does, as long as one party is aware it's being recorded. That one party would be you, the patient. Even though the medical provider is the expert, you are the captain of your team. You are the boss. It is your body, your choice. Know that informed consent and consent are not the same thing. You may be given informed consent, but consent is when you actually sign the form. Informed consent is the information you are given to sign that consent, whether you agree or not. Be aware if you are going to a doctor who specializes in certain procedures, their informed consent will most likely be biased towards their area of specialty. They may not list side effects that they feel are unimportant or they don't want you to know. They may not list alternative treatments due to their bias or their skill set limitations. Hospitals also play a major role in keeping silent medical providers to perform procedures using equipment of their latest financial investment. They need that equipment to be paid for. They need to turn a profit on that equipment. A prime example is stenting. Stenting happens to just about everybody. Stenting does not prevent heart attacks, but people are kind of told that if you get a stent, you won't have a heart attack. But stenting, the cardiac cath labs, it costs a lot of money. It costs a lot of money to train these people. And the last thing is, during informed consent is usually the time that they give you the anesthesia details. You need to know what will be used, who will be doing it. Are you going to have a doctor or are you going to have a nurse anesthesiologist? Do you want a male? Do you want a female? Do you want a certain anesthesiologist? Make sure that your requests are actually transferred to that consent form, because if they're not there, it didn't happen. Consent forms. Make sure you completely read those consent forms, all the fine print. Don't be surprised if the consent form you are signing does not contain the requirements you requested during the informed consent discussion. You have to insert them, because if they're not in writing, they didn't happen. The doctor can deny them. There is very good reason to state numbers 3 and 4, because if you only have verbal communication and you refuse any sales rep to be present or any medical student, if it's not noted on the consent form, again, it didn't happen. I have heard stories of medical providers switching out pages of the forms if the signature page is on a separate page from some of the corrections you've made. I've heard that they just simply will substitute in another consent form at the last moment after you're drugged. Although nothing is fail-proof, if someone really wants to commit a medical harm against you, despite all these precautions, it can still happen. That's the sad part. Most people believe that consent forms protect them, the patient, but maybe in the beginning when they were devised, but today's consent forms protect the medical provider, not you, the medical provider. The huge issue with consent forms are they do not give the patient the option to opt in, but rather you must opt out, which is more difficult because many patients are afraid of making the medical provider angry. Some facilities at the last moment during pre-op, when you're gowned and you have the IV flowing with sedation, will bring in a consent form and tell you they need your signature. They do that because they know that the drugs that they give make patients submissive, compliant. So if you've had stipulations like you don't want a med student present and they want that med student or resident present, they'll just slip that consent form in, say, here, sign it, you sign it, you're compliant. And it voids all previous consent forms. Many facilities will cram consent for anesthesia on the same form. They do that because you're less likely to ask questions and the anesthesiologist isn't there during the signing of those forms. Most of the time they'll pop in at some point and say, hey, I'm so-and-so and I'm going to do it. So that's basically how they get around a lot of that. Some facilities use electronic forms of consent, and those are very, very tricky because they do not have the ability to give you the ability to make changes. So what you must do is make changes on the signature line. Not only sign your name, but say, I don't agree to have students, I don't agree to photos, I don't agree. That's the only way you'll be able to do it. And also, you want to make sure that you get a copy of those electronic forms, or really any consent form. You have to get a copy of that with your signature. Some medical facilities use consent forms that have blanket clauses on them. A blanket clause gives the medical provider a broad definition of being able to do whatever they deem necessary. They could say what was discussed in a formal consent, informed consent, that the patient had the ability to ask questions then. The blanket clause is very dangerous. It is generally used to protect the medical provider from allegations of medical battery. It also, another blanket clause is written within the body that the doctor may substitute in anyone they desire to perform the procedure. Now that is kind of tricky because that's usually buried deep within the body, and you've had your long drawn out discussion with the person that you think that is going to do the procedure, but once you sign that consent form and that clause is in there, they can substitute in whoever they choose. Here's a dirty little secret about informed consent and consent forms that many patients do not know will happen to them. If you live in a state that has not banned unconsented for pelvic rectal exams, and there are more that have not than have, you could be a victim of what I term as group rape by medical students. Even if your state has banned that procedure, carefully read your consent form, as the wording may be dishonest, as they have found ways to skirt these laws. Misha Valinskaya wrote an article talking about unconsented for pelvic exam on female patients. The article is good, but it is lacking because she doesn't cover this barbaric practice that it also happens to male patients. And it's not only pelvic exams, it's rectal exams. One aspect of her article that bothered me more was that she interviewed a female doctor who is an OB-GYN, and this female doctor said that she was upset by doing an unconsented for pelvic exam on an unconscious woman. So afterwards, she went to talk to that woman to tell her how she was involved in her care. The doctor was not involved in this patient's care. She was there to further her education. What she did had no bearing on that lady's care. It was for her own good, not for the patient's good. So medical providers, including doctors, nurses, techs, whoever, they are taught early that patients are merely objects put there for their use. It is believed that you are giving implied consent, meaning because you went to a teaching hospital or university hospital, that you can use to further the education of any medical person that needs to be taught. So you have to be very careful, and because nowadays most hospitals consider themselves to be a teaching hospital in order to get residents to become doctors there later. So just be aware that most of them do consider themselves to be teaching hospitals. ER consent. According to several studies, emergency room care can be very dangerous and is a leading cause of malpractice suits. You can take steps to protect yourself, like make sure you have an advance directive naming your power of attorney. Make sure that you have talked with an attorney to make sure that this legal document is something that will stand up in court, because if they want to deny your advance directive, they will do it. And they will think that they can win in court against you if you try to challenge it. If you are conscious, make sure that someone you trust is notified that you are in the ER and will be present. Even in ER treatment, you have the right of refusal. Just because they say you need this, If you don't want it, you can say no. If you have allergies to medicine, or if you refuse to take one, make sure that that information is included in your medical record, because they can give you medicine that you have refused. So make sure that that is in your information. States also have laws regarding consent if you are unconscious or incapable of consenting. Excuse me. Check the laws in your state. Here in Indiana, if it is a true emergency, meaning you'll die, excuse me, I need to take a drink of water. Die within a few minutes, or you are unconscious, or they cannot find a next of kin, they do have what they call consent. But some ERs will exceed their rightful consent, so be very careful. At an ER, you are also more likely to have your bodily dignity compromised, because they believe that their time is more important than making sure that they preserve your dignity. Okay, you as a patient have absolute power to refuse any procedure that you do not want. You as a patient decides who will touch your body. Always make sure that you have a signed copy of your consent form. In some states, you are allowed to record encounters. Excuse me. Dignity is the respect, the communication, the empowerment, privacy, safety, acceptance, fairness shown to you as a human being who is a medical patient. Dignity, I classify two different ways. It can either be mental respect or it can be physical respect. Mental respect is how you're communicated to by the medical staff, or just generally how they treat you. Physical respect is how they treat your bodily dignity, which includes your privacy, which some people refer to as modesty. It is your safety, even how they allow your empowerment. How are you addressed? Do they just call you by your first name, or do they ask what your preference is? Do they make eye contact with you, or does the provider just stare at the computer screen? Do they use words or phrases that you don't understand? Do you feel overwhelmed? Do they talk to you like an equal, or do they treat you like a naughty 2-year-old? And this is where the paternalistic view comes into play. If they're doing that, that means that they're very paternalistic. You have to watch the wording that they use, because the words that they use are words that they use to control you. They will use words like doctor's orders, strip, you are not compliant, restrict, you must. Note their words. Physical dignity is your bodily dignity and safety. Sexual abuse is a physical indignity violation. It is also criminal. Arthur Shore wrote an article for Plaintiff Magazine in June of 2018 entitled Sexual Assault of Hospital Patients, where he stated, the sexual assault of hospital patients is a pandemic in a manner similar to which has been recently exposed in government, entertainment, sports, and business. Going on, Mr. Shore said the medical community ignores complaints and rationalizes the circumstances why it happened. He says that most abuse often occurs post-op or while the patient is emerging from anesthesia or sedation. It also should be added that pre-op is also a high time, as well as any room patient who has had sedation, because most of the time a room patient is going to be in that room alone with either a nurse or a tech, so there are no witnesses. Okay. Why this is happening is there are so many different reasons. There's very little in the way of screening employees, especially in the tech's nursing field. Also, patient medical providers relationship is very imbalanced. There is a marked imbalance of power between a patient. A patient will call a doctor, for instance, Dr. Smith. The doctor will call you Jane. That is a very marked imbalance of power. Why aren't sedated patients believed? The medical community has espoused for years that sedated patients are not aware of their surroundings, are mentally compromised, and subject to hallucinations, delusions. So if the medical people really believe this to be true, then why are they having sedated patients re-sign consent forms? That's a big, glaring double standard. Next, I'm going to talk a little bit about what my partner, Cindy Schwartz, has. She has a radio show that she does weekly, and she works on patient dignity issues. They say if it doesn't matter, you are under anesthesia. Cindy says it especially matters while you're under anesthesia because you are defenseless. Discuss beforehand the details of your procedures, what drugs, will there be a urinary catheter? They often use urinary catheters when there's no reason because it's a matter of convenience for them. Can I wear a surgery-specific bra or underwear? Can I bring my personal advocate? There are articles made especially for surgery that are sterile. So there is no reason for people to have to be exposed for, say, knee surgery. So make sure that you discuss beforehand, are you going to be stripped naked? They say, we don't have cloth gowns, they're too expensive. Paper cover-ups leave you freezing and exposed. You can bring your own. You can tell them they can charge you extra for a cloth gown. There's many different ways that you can get around that. They need to respect your right as a person. They say we only have opposite gender care, such as a tech or a nurse for your intimate procedure. It doesn't matter. They've seen it all before. Cindy says each patient deserves dignity and respect. It is a basic patient right. Leave the procedure if you don't think that they're respecting you or they're accommodating your wishes. Insist on rescheduling it somewhere else with someone else that you trust. The results can be sent to your doctor. They say we don't treat patients like that, or that didn't happen. Over 1 million patient abuse cases are reported each year. Do not rely on the facility's patient advocate. They work for the hospital, not you. They coerce, they gain as much information as they can from you to use against you. If they don't help, go to another agency, go to the police, keep going, but don't let them run out the statute of limitations on your case. That's what they like to do. Cindy says, when in doubt, leave. Get a second, third, even more opinions. Don't be afraid to speak up. It's never wrong to get the best care for yourself. Okay, Misty Roberts from Medical Patient Modesty has some great information for people. She has been doing this for a number of years, and she has a great many stories from people that have been sexually abused during a medical procedure. So just make sure that you take care, that you have someone with you at all times, because no one in a hospital, even doctors, will tell their family that they should never be alone while in hospital. Many times you are exposed unnecessarily, they shave unnecessarily. Sexual abuse by medical professionals is very common. She has a site listed here, www.sexualmisconductbydoctors.com. There's many articles and pointers on tips preventing sexual abuse. It also tells you how to report a medical professional for abuse. Many hospitals in America still have no underwear policy for any surgery that do not involve the genitals. Check out that article on medical patient modesty, because if you go in for foot surgery, you should be able to have your underwear on. You should not have to be exposed. And here's some more resources for medical patient modesty. She has brochures. She has brochures that you can give to medical professionals. She has information for medical professionals to be able to view and to get information and education themselves. There's also information on there where to buy some surgical garments in order to protect yourself. We have them. Everyone should have them. In fact, every hospital should be having them. Trauma-informed care is something that most people have no idea what it is, but providers should be using trauma-informed care protocols on everyone. This means they need to assume that all patients have suffered some sort of trauma in their life, usually sexual in nature, and use care protocol to acknowledge this. In short, TIC protocols do everything to empower the patient and make them feel safe. The medical provider should explain all aspects of the exam to the patient, and before they ever touch you, they need to ask your permission. They also need to realize that at any point during any exam that you have the right to ask them to stop or even to tell them to stop. There are many articles about TIC protocol available. Remember, when you ask a provider for TIC protocol, you don't have to tell them your reason that you need it. They just have to comply. Make sure that they explain and ask permission before touching you. They must. Most of them don't because they believe that you are something that they own, that you're there for their use. Make sure that you know that you have this right to same gender chaperones. A common misconception is that their chaperones are there for your protection. They are not. They're being paid by that medical provider. They will take their side unless they get mad at that medical provider. If you have no choice but to accept their provider, you can ask them to stand in a place in the room where they are not looking at your exposed body. They should not use the word strip when speaking to you because it implies a sexual meaning. No one should be told ever to strip. They must leave the room while you undress and redress. Now, for men, this most of the time and during a prostate exam, they will be there as the man is told to drop his pants and underwear, and then afterwards, after he's told to clean himself up. So you have an audience, usually containing the doctor, and most of the time it is a female chaperone. It is just barbaric that they're doing this. Do they offer you something appropriate to cover up with? Again, for men, this is more of a problem than for women. Have you been notified beforehand there will be a chaperone, or is it a deer in the headlights ambush? That's why many men do not go back for medical care, because they have had this deer in the headlights moment and they won't go back. Do they restrict traffic flow into the exam room while you're exposed? For women, this is especially important because a lot of times the exam table with your feet pointing towards the door, that's just very rude, and they are not protecting your dignity. Also, while the doctor is in the exam room, there should be no one else entering that room at any time. No one should come in and ask the doctor, well, did you know about so-and-so? No, that should not be happening. Be wary of being alone with a medical provider for an intimate exam. That should not be happening. You should at least have your person in the room with you. Limit your exposure. Demand to be covered. The only area that should be exposed at any time is the area being examined at that moment. There is no reason for the whole body to be exposed. For men, this happens more often than for women. Again, you have the right to refuse medical students or observers from being present during your exam. A lot of times doctors are shadowed, and some of those people shadowing them are introduced as medical students when they may only be middle school or high school students. Make sure that if you allow shadow medical students in the room, that you know who they are and what they are actually doing there. Again, if your need needs to be examined, you don't have to become fully undressed for your need to be examined. Watch for that kind of behavior. Medical records. Medical records are a big area of harm. Medical providers count on the fact that the majority of patients will never ask to see or receive copies of their medical records. Articles have been written that many doctors do not believe patients when they say that they have an allergic reaction to a medicine or that they've had a bad reaction to a medicine. Medical records are supposed to be legal documents of your medical encounter. It is a crime for that information to be intentionally falsified. However, falsification of medical records is common, as well as vital information being intentionally omitted. Either way, vital information being falsified or omitted can result in a patient being harmed. Here's some examples. Inaccurate information or omitted information, such as if you're allergic to a certain medicine and it is given to you, it can kill you. So make sure that you know what is in your medical records. Make sure as they're writing it, did you get that I'm allergic to that? Make sure, question them. And even then, it's still not perfect. Electronic health records is a whole different game. It is easier to share your health information, but not all health providers need to see all your information. Your foot doctor does not need to see your gynecology exam records. There's no way, but they have access. If your medical records have inaccurate entries, those will most likely follow you through your life. You can ask for corrections to be made, but generally providers are unwilling to allow corrections. State laws concerning the ownership of medical records may vary from state to state. Check your state laws. But most states agree that the information contained within the medical records is yours, but the medium in which they are on are owned by the medical providers. That leaves most patients unable to control their medical records. One of the most concerning dangers of EHRs is most systems have prompts, cut and paste capability, and standardized specific criteria that needs to be done with each treatment and procedure. In other words, it tells them the step by step, the standard treatment protocol. It is done to avoid giving patients ammunition for malpractice claims. For example, informed consent is something that needs to be done, but wasn't done. So as they are inputting the records into the system, they are prompted by the system saying informed consent completed. So they'll just go and grab a phrase that they have stored and paste in consent, informed consent completed. The EHR system allows for stored phrases to be cut and pasted into the records, hence why some MRs contain false phrases. In nursing cases, it is especially true as they are supposed to do certain routine care aspects that are oftentimes skipped. Because of the EHR system prompts, they will input the care as being completed. This is a very dangerous practice. The other thing that these systems allow are timestamps of when a treatment has been performed so that it can be manipulated to give a false narrative of care. Very, very dangerous. Patient Bill of Rights, most hospitals have them. They'll give them to you when you're admitted. The federal government actually has the Patient Bill of Rights. Sadly, none of these Bill of Rights mean anything as they are just words on papers that lure patients into having a false sense of safety, security. These Bill of Rights are an implied contract that state no exceptions, exclusions, and do not disclose the consequences when they have been breached. What needs to happen is we need to find a lawyer to take a class action lawsuit by patients who have had their rights violated. They either need to honor these currently on paper rights or cease printing them and distributing them or make them enforceable, because they really should be a legally binding document.
Jeane, I'm jumping in here for a quick minute because we're at the point we have to start to open it up for Q&A.
Okay.
So are you close to where you want to be, or?
I have just 2 more slides, I believe.
Okay, go for it.
Okay. Medical malpractice insurance does not cover intentional harm. Most harmed patients are never able to get legal representation. Even those who are able to get legal representation rarely will win. Oh, I messed up. The other thing are medical boards. They are very, very much pro-doctor. They will twist and lie in order to save the doctor. Jim Axelrod did a very good piece on CBS this morning about corrupted medical boards, which one happened to be here in Indiana. Okay, when your dignity and autonomy are ignored and not respected, medical harm is more likely to happen. Medical harm happens when they fail to see you as a human being. You are an object they own and an object they can manipulate. Advocate for yourself, and if you can't, have someone that will. Don't depend on them to respect your rights, as many times they will not. Okay, we are finished.
Okay, and then this is the contact information, in other words. Oh, yeah,
Yes.
this is okay, perfect. Okay, well, we got there. They're great. All right, let's take some questions. In fact, and I see Charles is already chomping at the bit there.
Oh, I did forget to put in my Twitter handle. It looks like.
Okay, you have to send that to me subsequently. Charles, you there?
Yes, and I think Dr. Feldstein had a question about accidental deaths from doctors as being one of the leading causes of death in the country. So if he wants to raise his hand and ask about that or some other issue, he's welcome. For my question, Jeane, have you seen any upgrading in patients' desire to take more control in the healthcare system? Because Jeff and I got featured in Forbes for upgrading patients into cash patients so they can have more choices, because there is an imbalance in the current system. So we're definitely into patients shopping around and getting second opinions and taking more control over their decisions. Have you found, based on this abuse, any willingness or desire on the part of patients to look deeper into the system to see how they can get more control?
I see that patients who don't have access to this type of information, they're fine because they don't want to rock the boat. But once we start talking to them and telling them this kind of information, then they're like, oh, well, that happened to me. Oh, I need to learn this. I need to do that. So I think education and just getting it out there is a key to get change to come about, because many people have been taught from small age that you respect the doctor. If the doctor says this, then that's how it's going to be. But I see, especially with this COVID thing and all the mistakes that the medical community has made, that I think people are now starting to question things more. Hopefully that will be one good thing that comes from this.
Murray, I saw your hand was up.
So thank you for your presentation. I agree with a lot what you said. As just to orient you, I am a urologist. I've been involved in many of the things that you concern yourself with, and I've been in the profession for over 50 years. I've taught medical students. I've worked on Indian reservations in some of the most backward areas, and also in academic centers at the Mayo Clinic for 15 years. So, and I have some questions. I would not disagree with anything you said in terms of these things do happen.
Mm-hmm.
I do feel I don't recognize my profession when I hear you talk, though. So I realize that I could be naive. I don't think I am. But while these things happen, I would question the frequency or the motives which it happens. And I've been there when patients say to me, I do not want a medical student.
Mm-hmm.
And I have never heard any physician that I've worked with be disrespectful to that. I've tried my best to see if I could get the patient to agree, because I think the only way we teach good healthcare providers is to let them see the patients with the disease. But I've never forced one on a patient. I don't know any of my colleagues that have done that, and I've taught generations of students.
Mm-hmm.
When people come to the Mayo Clinic, they know it's a teaching hospital. They know it's one of our 3 shields. And most people are generously very willing to help us all teach good.
Right.
I've also, been there. I've taken care of both men and women and their most private questions, parts, intimate concerns.
Mm-hmm.
And again, I don't recognize my profession in your talk. So I only really have 1 or 2 questions.
Mm-hmm.
One is, I'd like to know the references that you're using in terms of the absolute numbers of people. And the reason why I would, not that I'm going to disagree, because I don't have the information to disagree with those numbers, but I'd like to review the information, review the data, review the methods by which they were collected, how they categorized it, what their controls were, so that I can more intelligently discuss this in the future. I know that all the things you worry about happened. I know that the profession is aware of that and is doing a good job of trying to prevent these things from happening again. I have never seen, and believe me, I've been in the operating room for over 45, 50 years. I've never seen once anybody try to get somebody to change a consent form after they were sedated. That is such a no-no that I've never seen it, and I've never heard. I mean, that maybe 30 years ago, but certainly in the climate we're in now, and I think it's a good climate. I think it's important to do the kinds of things that you say. I don't see that happening. I'll say one more thing and then I'll shut up and let you respond. And that is, I'm also a consultant to the Arizona Medical Board. In other words, I do investigate problems that when doctors are accused of doing bad things. And I've taken my share of them and chastised them officially. They've been punished. Mm-hmm. It's not easy to change a medical record these days. The biggest problems with medical records this day is cutting and pasting information back in, which makes them hard to read. But I can generally easily pick up when somebody's tried to doctor their records and insert something that's changed, because that will loosen their license and cost them millions of dollars in malpractice in a moment's change. So anybody that's doing that, and I've caught a couple, that is pretty well known. So I'm a big critic of the medical profession as it is now. I agree that we need to give patients more power. I see it being done by making it a more market-based economy, and I've written, published, and will be publishing more in the near future on this. But in terms of how you're presenting the motives of the profession, I can't completely buy it. I'm sorry, but that's how I feel, and I'll shut up and let you respond.
Well, as I said, not all medical professionals are doing this, but there are some. Now, I am a spouse of a medical abuse. My husband was medically abused. He was both medically abused and sexually abused. Part of his issue was lack of consent. He had no consent. CMS agreed there was no consent. However, they said he should just be glad to be alive. I have people on Twitter who have had consent issues. Either they did not consent or the consent was exceeded. So yes, it does happen. It may not be an everyday occurrence, but it is happening. I know of another lady here in Indiana whose consent was exceeded. As far as some of the other issues, medical records, my husband's, I can give his medical records are falsified so badly that they are unusable. They have in there that he had a baby. They have in there that he is a gay married man. He is not. He's married, but he's not gay, and I'm not a man. They had in there that they did one thing, then on another page they didn't do it. So yes, the nurse directly lied. She went through and checked the things that she knew she was supposed to do, but she didn't do. On my Twitter account, there are more people like me that have had these things happen. So yes, they're not happening all the time, but they are happening enough that you don't know if you are going to be a victim of this, because like in other professions, there are bad medical people. And here in Indiana, our medical board has been written up for its corruption. And I will agree. My other friend here in Indiana, she went through the medical review board and they twisted themselves into pretzels to defend the doctor, even going so far as to say that there was an under the table agreement. What? You mean the consent form isn't valid, that an under a table agreement outweighs a signed consent form? No, that just doesn't happen. So there are issues. Healthcare needs to be perfect because you're dealing with people's lives. We need to have more controls put into place to weed out the ones who want to do harm or do harm because they are careless. Intentional harm is getting more and more news media because intentional harm involves sexual assault. Sexual assault is happening more nowadays because women are becoming more empowered, and because of Me Too, some women feel that they do have the right to be judge and jury on a defenseless male patient to sexually abuse them. I do know this for a fact. So there are things. Are they everywhere? Are they overwhelmingly everywhere? Yes, they're everywhere. No, they're not an overwhelming makeup of the medical profession. We've had this discussion many times with Dr. Maurice Bernstein on the bioethics blog, Patient Dignity. It's an ongoing discussion. My Twitter account, as I said, it's full of it. If you look on the internet to any number of patient sites, you'll see the same thing being talked about. So Dr. Bernstein used to call us an outlier, but no, we're not outliers. This is actually happening and this needs to be addressed.
Well, Jeane, if you could send me or email somehow either Jeff or Chuck, Charles Frohman, and give me the references that quantify the number. You gave a number that was in the first slide. Was it 200? What was the number?
250,000 to 400,000, depending on your source. I think Johns Hopkins is the 250,000, and it goes all the way up to 400,000. It just depends on the source that you get. But
if you could send me the references you're using, I would appreciate it.
I thought I had that highlighted in my presentation, but maybe I didn't. I thought I had a footnote, but maybe I didn't.
Okay, we can follow up on that part of it for sure. So yeah, it's definitely, obviously, if we're even talking about it, it's definitely a little conjecture, maybe in some respects, the magnitude of it. But the fact, like you said, that's even happening at all is already unacceptable. So it's definitely something to be a part of everything else. And again, a lot of it, like what we promote, is the idea of pricing transparent and everything. A lot of all this obfuscation all kind of fits together. One leads to the other, and it's bad in all that respect. Because if they had a kind of answer like any other merchant to consumer controls over whether I shop at your store or not, or your pricings are too high, but they're not. They have no idea. They just get paid. The insurance is paying for stuff. No one even knows. We're here in town. The clinic, for some procedures, there's 200 different prices for the same procedure. Well, how can that possibly be? I've never seen more than one price at a McDonald's. But it's that kind of thing. So it's definitely a bit of a mess. So I appreciate you kind of enlightening us today. And obviously, this is a story that's long from being the conclusion. We're just really more at the beginning of the story now in many ways. So thanks so much today.
Thank you. And anyone can feel free, once I get my contact information, to contact me or join me on Twitter at Roller-Rights4Patients. And we can carry this discussion on, because the only way we're going to get anything done is being able to discuss this in a civil manner.